Hello, my name is Kimberly Zazar. Today we will be discussing influenza, also known as the flu. Now, I'm pretty sure everyone in here has gotten sick at least once in their life, and your initial reaction is, oh, it's just a small cold, it will go away on its own, or you will take some over-the-counter medication, which can be effective, but it is always important to get medically evaluated to get the proper medical treatment. Now, what is influenza? Influenza is a viral infection that can affect your respiratory system. For example, your nose, throat, lungs, which is important to get medically evaluated because if it's not treated, it could cause death or deadlier viruses such as pneumonia. Now, how do you catch the flu? The flu travels through air droplets when someone with the infection sneezes or talks, which is why it's important to avoid crowds like this around flu season to not get so close to many people. Now, you have no symptoms doesn't mean you could still have it. Yes, symptoms can begin from about 2 days, range from 1 to 4 days as soon as it enters the body. Meaning you could have, you could be a carrier and you could have the flu, but you are not experiencing any of the symptoms, which is why it's important to make sure you're aware of any different changes in your body or just any other feelings that are not typically normal. Now, some common symptoms are sore throat, pain in the muscles, cough, runny nose, fever, headaches. But because viruses are constantly changing, it means that the symptoms could change as well. Now, for further research, vaccine could even be changed into something else because of how viruses are always changing into something else. But with these symptoms, there also come risk factors. Now, people with asthma, heart disease, diabetes, and several other chronic health conditions are at higher risk of developing serious flu complications that can result in hospitalization or even death. Now, in recent years, it's estimated that 70% and 85% of seasonal flu deaths occurred in people 65 or older. This is why it's important to understand your past family conditions to take extra care of yourself if you have anything that could affect your respiratory system, because it could lead to more complications later on. Now, some prevention measures are to annually get your shots. CDC recommends to get vaccinated from as early as 6 months and older. But for everyday prevention, always sanitize anything being touched. Wash your hands frequently and stay at home if you are sick. Now, the reason for sanitizing things that are being touched is because many people tend to touch things and then you'll touch your face, which can be transferred onto the skin and it will just keep leading up and building up germs. Now, this is not just for the flu, but it's for anything as well. But in conclusion, in this new generation where COVID-19 can be confused with the flu, it is important to always be in public, to be safe in public and constantly take precautionary measures to avoid any types of viruses. The flu is a very contagious respiratory illness that can affect many, so it is important to understand such deadly virus. These are my sources. I have influenza incidents overlapped with COVID-19 under COVID-19 control measures. A review on equine influenzas from a human influenza perspective. Does knowing the influenza epidemic threshold has been reached into